Insulin resistance is a global epidemic of the 21st century. Worldwide, the prevalence of insulin resistance among adults ranges from approximately 15.5% to as high as 46.5%, depending on the region. Here are examples from medical studies across different regions. Europe, around 15.5% of adults. Lebanon, 44.6%. Venezuela, 46.5%. Texas, USA, 39.1%. Southeast Asia, average of 44.3%, including Malaysia, 50.4%. Indonesia, 44.2%. Before we start talking about insulin resistance, it's important to first understand what insulin actually is. Welcome to Less Stress Zone, Holistic Health. Don't forget to like this video, leave a comment if you find it helpful, and subscribe to our channel for more science-based health content. Insulin is an anabolic peptide hormone with systemic effects, playing a key role in metabolism, primarily of carbohydrates, but also fats and proteins. It is secreted by the beta cells of the isolates of Langerhans, the endocrine part of the pancreas. Its most important function is to regulate blood glucose levels, both in the fasting state and after meals. The main target organs of insulin are the liver, adipose tissue, and skeletal muscles. Insulin acts as a central energy regulator, signaling to the body that energy is available and should be distributed or stored. It's a hormone of life and metabolic balance. What is insulin resistance? Insulin resistance is not officially classified as a disease in international diagnostic systems. From a medical perspective, it is considered a metabolic disorder in which tissues, especially muscle, fat, and liver, become less responsive to insulin even when its levels in the blood are normal or elevated. In practice, this means that although the pancreas produces insulin correctly, or even in excess, the tissues are unable to properly absorb glucose from the blood. In response, the body increases insulin production to keep blood sugar levels normal. This state of increased demand for insulin is called hyperinsulinemia, and it is often one of the first signs of metabolic dysfunction. What's important is that insulin resistance often shows no symptoms. You can have normal fasting glucose levels, yet your body may already struggle to handle sugar effectively. What causes insulin resistance? The most common causes are linked to lifestyle factors, including a high-calorie diet rich in high glycemic index foods, frequent overeating, lack of physical activity, and a sedentary lifestyle, obesity, especially excess abdominal fat, chronic sleep deprivation, persistent stress with elevated cortisol levels. Other contributing factors include hormonal disorders such as polycystic ovary syndrome, PCOS, in women or hypogonadism in men, certain medications including isoniazid, rifampicin, also known as rifampin, and corticosteroids used in autoimmune conditions. Vitamin D deficiency may also play a role. What are the consequences of untreated insulin resistance? If left unmanaged, insulin resistance can lead to serious health complications such as type 2 diabetes, hypertension and atherosclerosis, metabolic syndrome, metabolic-associated fatty liver disease, cardiovascular disease and stroke, fertility problems, particularly in women. How is insulin resistance diagnosed? Insulin resistance can develop silently over time without any noticeable symptoms. That's why it is most often detected through laboratory testing. There is no single gold standard test, but several markers and diagnostic tools can help assess the risk. 1. Fasting blood tests. One of the simplest ways to assess the risk of insulin resistance is by measuring fasting glucose and insulin levels in a blood test. Based on these two values, you can calculate the HOMA-IR index, homeostatic model assessment of insulin resistance, which estimates how responsive your cells are to insulin. To calculate your HOMA-IR, multiply fasting glucose by fasting insulin. If glucose is in milligrams per deciliter, divide by 405. If it's in millimoles per liter, divide by 22.5. Important. Because insulin is secreted in pulses, it's best to perform the test 3 to 4 times and average the results. A result above 2.5 to 3.0 may suggest insulin resistance. But it's important to remember that HOMA-IR is a mathematical model, not a definitive diagnosis. It's a useful screening tool, but it does not replace a full clinical evaluation by a healthcare professional. 2. OGTT, oral glucose tolerance test with insulin measurements. If fasting glucose and insulin levels raise concern, your doctor may recommend an oral glucose tolerance test, OGTT, with additional insulin measurements. This test involves fasting overnight, followed by a blood draw to measure your baseline glucose and insulin levels. After drinking a solution containing 75 grams of glucose, your blood is tested again at 1 and 2 hours to see how your body processes sugar and how insulin responds. Typically, during routine screening, only fasting glucose and the 120-minute result are measured. The 60-minute reading is typically included only in pregnancy-related testing, when insulin is measured at all 3 time points, at 0, 60, and 120 minutes. It can reveal early metabolic disturbances, even when glucose levels are still within the normal range. This is often the stage when insulin resistance can be detected early, before diabetes develops. 3. Clinical indicators, visible signs in the patient. Laboratory results are important, but there are also physical signs that may indicate insulin resistance. Abdominal obesity. In this context, it refers to waist circumference. According to the International Diabetes Federation, the thresholds vary by region. Over 94 centimeters in men and over 80 centimeters in women for European, Sub-Saharan African, Eastern Mediterranean and Middle East populations, over 90 centimeters in men and over 80 centimeters in women for South Asian, Chinese, Japanese, and ethnic South and Central American populations. In the United States, the National Cholesterol Education Program uses higher values, 102 centimeters for men and 88 centimeters for women. Other physical signs may include adult-onset acne, oily skin, and menstrual irregularities, hypertension, elevated triglycerides, and low HDL cholesterol, dark skin patches on the neck, armpits, or groin, a condition known as acanthosis nigricans. To sum up, insulin resistance cannot be diagnosed based on a single test. It requires a comprehensive assessment of blood work, physical symptoms, lifestyle factors, and risk indicators such as excess weight, chronic stress, unhealthy eating habits, and low physical activity. Consult your doctor if you have any concerns. The earlier you catch insulin resistance, the better your chances of turning things around and avoiding serious long-term health problems. You only need to focus on a few key areas of your lifestyle, and we'll talk more about that in our next video. Don't forget to subscribe to our channel so you won't miss what's coming next. Your support helps us grow and reach more people who care about their health.